So the European Alliance for Value in Health aims to facilitate the transition towards value-based healthcare by effectively coordinating and cooperating between different groups in the European health system. So value-based healthcare is all about putting patients at the centre and focusing on outcomes that matter to patients. We believe that the transition to value-based healthcare requires us to do two things. First of all, we need to effectively communicate so we can collaborate better together. Second of all, it's helpful if we understand the roles and responsibilities that each stakeholder group should be taking in this transition towards value-based healthcare. So to address the first point, last year we published a report called Talking Value, a taxonomy on value-based healthcare, where we aim to define some of these different terms that are used in value-based healthcare. For example, value itself, how do we define value? Secondly, we aimed to address the roles and responsibilities of different stakeholders, which we did by publishing a report earlier this year on a compass for collaboration. Here we analysed different stakeholder groups and the roles they should ideally be taking to help transition towards value-based healthcare in Europe. The European Alliance for Value in Health proposes that we have more diffusion laterally and to have more top-down initiatives to help facilitate the adoption of value-based healthcare in Europe. So far, there's some fantastic pilot initiatives that are happening, but these are kind of localized to individual hospitals. For example, we've heard so far the EHMA conference, some great initiatives happening in, for example, Dutch hospitals, happening in different local hospitals. But these sharings, these learnings need to be shared across different hospitals so that they can be implemented elsewhere. We also need to have a bit of more top-down initiatives. For example, we need to have more investment into digital infrastructure, and we need to have more investment into education. And it's helpful to be changing our payment models to be more value-based as well. So, for example, in the Netherlands, there has been recently the National Care Act aiming to fund innovation. So one of the initiatives that has been announced recently is the Pan-European Observatory by H2O. So the Health Outcomes Observatories, H2O, have been trying to enable data infrastructure so data sharing can happen across Europe. So that's something that's been announced recently. That's a really exciting initiative.